Good evening, everyone. Today in this session, we will discuss about one of the department that one call it as a heart of the hospital. Nothing but that is the ICU. ICU means intensive care unit, and then what is the meaning of ICU? What is the structure? And then what is the staffing pattern we can see? And then what is the important procedures they are doing in the ICU setup? And then what are all important medication that will be used in the ICU setup, and then important abbreviations used in the ICU. We will discuss about this in this session. Usually for the nurses and then beginners of the ICU setup, and then this is much useful. See here in this you can see the ICU setup. See here is the you can see the nurse, and then here is the ventilator. Here you can see the cardiac monitor. Here is the doctor. He is discussing with the patient. You can see this is the usual setup of the ICU. Then what is the meaning of the ICU? ICU it's a simple intensive care unit. Intensive, it means this is the one unit, and then it is going with individual care approach. It means in ward and all we can see usually the staffing pattern staffs will be less, and then staff patient ratio will be high, and then in ICU setup usually 1:1 ratio will be there. That is the thing, because the required care is much, means required care, and then close monitoring, it will be essential in the ICU setup. And that is an intensive means, it means there will be continuous monitoring care, it should be there, and then with sophisticated equipment also it's required. And then in olden days they used to call it as an intensive therapy unit, intensive nursing care department. In older days they used to call it as a ICU. And then nowadays this ICU they will call it as a critical care unit, because usually this ICU they will deal with the caring of critically ill patients, and usually this ICU will be mainly focuses to treat very sick, and then artificially respiratory support needed. Suppose patient may need this one ventilator support, like that patients. And then acute or chronically ill patient. Acute usually injured patient, means trauma patients, severe infection patients, and then chronically ill patients, ESRD patients with hypotension, and then patient may need emergency dialysis, and then patient may need inotrope support, like these cases usually treat in the ICU setup. Usually in the ICU setup and all intensivist, nothing but ICU doctors, they will call it as an intensivist. Their decision usually always prioritize above than the primary physician, because they are the one in the ICU doctors, the one they are specially trained in the treating of critically ill patients. That's why usually the ICU doctors decisions will be the main thing. Then see here you can see the ICU setup. Here you can see the here bed to bed space will be there. Every bed attached with one monitor, one cardiac monitor and ventilator. You can see here patient locker will be there. Here is the one doctor is doing the rounds. You can see the patients here. And then what is the patient single curtain will be there. This is the, here is the nurse station. You can see here. Here is the direct utility room. Usually ICU setup will be like this is there, and then usually it has all the, means as a ICU it should contain all the necessary equipments and all, syringe pump, infusion pumps, ventilators, and then defibrillator, everything it should be there. Then we'll go to the introductions. It's like a overview when it started, like that. See, usually this Florence Nightingale, she is the one pioneer for the ICU setup. Usually in the older era they used to call ICU as a intensive nursing care unit. It means it is a approach in that nurses usually they are the one taking care of the unit, and then doctor he is the one giving the instructions and all, like that. And then Florence Nightingale in the during Crimean War, there was huge number of casualties. Usually because of the war, no, there was more casualties and then more injured soldiers and that. In order to treat, Florence Nightingale, she is the one started the ICU concept of ICU and all. Usually from the means that time from the 1854 to 1950 there was not that much development and all, but after the 1950 there was introduction of the mechanical ventilator, introduction of the syringe pumps, infusion pumps, and then what we call one of the magic thing, introduction of the hemodialysis, the concept of ICU. It's became developed like anything, and then it's improved. That is the thing with the development of techniques of hemodialysis and the widespread of introduction of mechanical ventilator. After the World War II, ICU setup, it became the heart. It means it became like a heart of an hospital or healthcare system. That is the one. And then usually the hospital, we can call it as a good or equipped or sophisticated to treatments. Usually decide the ICU means what is the setup of the ICU. It decides the means it implies the means it indicates the hospital status and that is the thing. You can see in the olden days, you can see she's a nurse and then she is treating the patient. Here also you can see the nurses and the patients, they are documenting the things and all you can see here. These are all the olden days. Ibsen is from the Denmark. He is the one first introduced mechanical ventilation support for the polio attacked the patient, and then usually polio it will cause the severe respiratory distress and all. In that case he used first mechanical ventilator concept, and then he is the one I established intensive care with mechanical ventilator introduction. After that the what we can say status of the ICU and then the development it's increased more, that is the thing. And then usually this ICU individual or immediate after the initial registration from the emergency room or casualty room, the secondary approach will be there. Suppose one what we can say one injured trauma patient came, he had the head. I'm giving one example. Suppose patient came with history of RTA, road traffic accident, and then he had bleeding. That time usually in emergency room, what we can see, there will be specialized unit like a CPR. They will say cardiopulmonary pulmonary resuscitation unit. It's like a ICU, but the capacity and then equipment ratio it will be less. Like that patient, they will settle. Means usually fluid resuscitation they will do. Suppose patient need inotropes and the mechanical ventilator, they will introduce, and then they will say next step. What we can say immediate demands of the individual care means immediate after the immediate resuscitation. This is the one unit. It will take care of the patient further health. Suppose it will. This is the one. Then within the hospital, ICU provides the capacity of the care for acutely unstable patients to evaluate, resuscitate. Even suppose patient will be had any cardiac arrest and all, usually there will be specialized team, they will take care of this. And then usually advanced facilities will be there. See multiple in the further clips we can see the what and all the equipments we are using, and then what and all the medications we can see in the later in the session we can see. Yeah, this is the one. This ICU, it is the one thing usually after the initial resuscitation, the individual requirement it will be fulfilled here. Then you can see here, this is the classical, you can see that this is ECMO patient, you can see here, this is the ECMO machine, you can see the ECMO machine. Extra ECMO machine means it is like a extracorporeal membranous oxygenation machine, you can see here. You can see the hemodialysis, it's ongoing here. This is the prismaplex, here they are doing the this one, that what we can see hemodialysis, and you can see the infusion pumps, syringe pumps, here fluid resuscitation you can see. And then behind this there is some cardiac monitor, everything is there. Here you can see this is the one, and then this patient here is the patient. This is the one unit we can treat highly sick and highly critically ill patients, we can see here in this. Then what is the intensive care? What is the intensive care? Means this word intensive care. This is the care, usually it is focused on the close monitoring 24/7, 24/7 monitoring care will be there. And then it is a unit or It is a multidisciplinary and interprofessional specialty dedicated to the comprehensive management of patients having or at risk of developing acute or life-threatening organ dysfunction. I mean, this is the unit, and then it will go with the this one multidisciplinary team approach. Means it means this ICU indicate means ICU includes doctors, nurses, dietitian, then physiotherapist, respiratory therapist, then housekeeping department, everything. Everything it's included, and then usually in that plan of care everything they will be usually they will individual means patient oriented things will be carried out here, and then usually the management will be comprehensive management will be there. That is the thing. Then usually for treating the risky patients, suppose patient is having severely hypotensive, if there will be correct resuscitation, it means there will be correct means there will be correct treatment. It means I mean suppose patient we are giving correct positive ionitro support, and then suppose patient may need ventilator support, and then if we are giving everything means the depth of means the risk of developing MARDS means multi-organ dysfunction syndrome or multi this one organ dysfunction we can avoid with proper ICU care. That is the thing. Then intensive care uses array of technologies that provide support of following organ systems means failing organ system, particularly lungs, cardiovascular system and kidneys, primarily managed to sepsis and ARDS. Usually this this one ICU, it is indicated to manage sepsis and ARDS. Sepsis, I think you know, untreated septic shock means there will be bacteria inside inside of our body. There is no correct management means patient will go for sepsis. Suppose sepsis, if you are not managing correctly means patient will go to organ dysfunction. This is the thing. Means organ dysfunction now it is, and then there will be lack of blood circulation, and then there will be cytokinin introduction, more things will be happen, and then at last septic shock it will cause it to the organ dysfunction. Organ dysfunction may lead to cardiac arrest. This is the thing. Even ARDS also, acute respiratory distress syndrome. It is the things, nothing but the alveoli means structural and functional unit of the lung, it will become bulged, means there will be fluid collection inside the alveoli and lung parenchyma. It will, because of this patient can unable to take the breath, and then he cannot do respiration and all. Because of this again patient will go for organ dysfunction, again cardiac arrest, and then there will be chances of death. That is the thing. Usually this intensive care mainly focuses to treat sepsis, ARDS cases, and then one more thing, fluid resuscitation. This one also it will be done in the ICU setup. And then the primary goal of intensive care is to prevent further physiological deterioration while the underlying disease is treated and resolved. Suppose patient had a stroke. In that cases, if you are maintaining correct ICP level, suppose if your doctor will give this much target BP map and all, if you are maintaining everything means the secondary brain injury, it will not happen, and then it will not further destruct the functional capacity of the patient. That is the reason you can say this intensive care, it is the must and should to regain or rebuild or resuscitate patient health. That is the thing. See, you can see here this one. This is the multidisciplinary approach. See here you can see ICU unit or critical care unit. Here you can see all the things will be there. Here it is connected with the operating theatre, emergency care. Usually this is the primary one. Usually initial resuscitation it will be happening here. Radiology, even for investigation, CT, brain, MRI, this radiology department is essential. And then sterile supplies and all for the dressings and all it is required. And then pharmacy is like a backbone of the ICU. If there is no proper supply of the medications and all, it will be difficult to manage. Otherwise there should be for correct means goodly sophisticated pharmacy should be there. And then infection control, this is the one thing, because when recent era they are telling the infection rate of the hospital. If it is increased means it will delays the patient recovery, or it may cause the morbidity of the patient. That's why infection control also it is the essential part of the critical care unit. You can see here. Now we will go to the ICU structure. This ICU structure, it's like a structure. It should be near to the emergency room, because suppose if emergency room in the ground floor and then ICU in the third floor means there will be interruption, because usually sick patient, double inotrope, triple inotrope patients and all, no, and then patient need a ventilator support. If there is more gap means there will be high chances of treatment interruptions. So usually as per the guidelines, and then there should be emergency this ICU setup. It should be near to the emergency room or operation theatre, OTs and all. It should be near. Then usually upper ground floor, because lower ground floor there will be for the this one ventilation purpose and all. Usually guidelines it will say upper ground floor is the good for the ICU structures and all, because of the good ventilation, and then good for logistics supply. Because of the ICU it needs good logistics supplies and also infusion set, syringes, cannula, all the things, IV lines, everything it will become here. The physical space of an ICU should be larger enough to comfortably accommodate the desired number of ICU beds. You can see in the, I think you just you observed here, I think you can see here. See here, there will be adequate space in between. You can see here. You can see here. There is adequate space in between the patient, because if you are at if beds are very nearby means there will be high chances of crossbar means cross infections and all. So there should be adequate space should be there in between the bed and all. This is the one. Then you can see, then see here, each bed needs access from all sides to each bed needs access from all sides to allow patients assessment and treatment and effective reliable implementation of infection control. What is certain shown in that photo, there should be adequate this one gap means adequate space should be there in order to allow patient assessment. Means doctor we can stand, no, and then even nurses, what we are nurses, we are also giving medications. There should be adequate space, that is the thing. And then even in implementation of infection control measures also there should be adequate space. This is the one, it should be there. Then see, ideally each patient should be cared for in a single bedroom. You can see in what I am working in the hospital, in that ICU setup is usually that one patient for one single room, like that is there. Means it is like a closed approach. Each room should have a sink and incorporated design features accommodate and provide easy access to supportive devices such as ventilator, dialysis machine, as well as monitors. What we can see in this picture, you can just observe this one. Here you can see here, you see here, this is the ventilator. Then you can see the monitor, it's just above, cannot see here. Even syringe pump you can see, this is the syringe pump arrangement. You can see the mechanical ventilator here. Then you can see here everything is there. Here saline bottle is holding, everything is there here. Here the ventilator, this one is there, connection is there, you can see here. This is the one thing, it's very essential. Then individual beds and rooms should be arranged in such a way that visible from a central nursing station. It means that nursing station, it should be, it's usually recommended to, it should be in the center, because we can see each of the patient. And then suppose in closed room means in our in what I am working in my hospital, what is the ICU setup means, there will be central monitor, because all the closed rooms are there. So we have central monitor. In that we can see the patient cardiac monitor, and we can see the vital signs and our patients. And then there should be sufficient space to allow family members to visit, even participate in the care of the patient. This is the one. Usually the tall ICUs, it will be having some side or back you can see the window. In that glassly tightened windows will be there. With that patient relative, they can see the patient like this. The ICU ideally will have one or more negative pressure room. This is one of the important thing. In order to avoid some negative pressures, usually airborne cases like tuberculosis and all, there should be requirement of the negative pressure room should be there. So usually ICU should have two, or based on the bed capacity, there should be negative pressure rooms to isolate the patient, to avoid the infection transmission and all. That is the thing. I think you saw this one in the, see here you can see the ventilator, you can see the monitor here, syringe pump, infusion pump, everything is there here, even bed, everything is there here. Then next thing is separate areas should be available for mixing and dispensing medication. This is the one thing for preparation of medications and all. There should be one separate cabinet should be there. This is also one of the thing. And then central nursing station should reproduce data from individual patients monitors. Means in the central nursing station there should be the one central monitor to collect the data, and then we can, with that data now we can analyze patient the condition and all. And then suppose patient is going for the hypotension or desaturation, immediately we can take the action. That is the thing. Then one or more seminar rooms and sleeping facilities for on-call staff should be available in immediate proximity to the nursing. There should be good restrooms for the doctors, for nurses or on-call duty staffs. It should be there. There should be waiting area for relatives. Means in order to see this one, usually ICU it will go with the multi-team approach. In that family counseling also it is one of the important part. See, in that waiting area should be there, and then there will be one family counseling room. In that every day, means during visiting our patient, in every hospital they have specific time, 1 hour or 2 hour like that. In that time patient relatives will come, and then there will be doctor, and then there will be coordinator. In front of the coordinator, doctor, he will explain the patient condition to the family. That is the one. See here, discussion room should be there. And then proper fire safety protocols. It is one of the must and should thing. It should be in the ICU setup. Suppose there is no fire safety protocols, means it's difficulty, because usually ICU it is a prolonged bedridden, and then usually the patient will be sedated. Like this patients easily evacuation it is not possible. So there should be, so in order to avoid that delays, and then there should be proper fire safety protocols. Means that for fire extinguishers, hose reel, and then these things all should be there, and then proper exit doors, everything should be there. This is the one. Then staffing pattern in ICU and all, we can see the staffing pattern. Usually the ratio of the staff and patient, means patient and staff ratio, it will be 1:1. Suppose be like ECMO cases, severely infected, means multiple infusion, means suppose patient is having multiple inotrope support, sedation, severely injured, and then like this patient 1:1 is recommended. And then lower acuity patients, means usually step 1, step 2, like that they will tell. Step 1 means in that area, and then patient is very sick, means patient need good care, means there will be high inotrope support, sedation, infusion rates will be high, and then patient is having high ventilator settings. Like these cases, usually they will call it as a highly critical patients. Low acuity patient like COPD patients, and then they need an attention, tracheostomized, but patient is ventilator support. These patients under we can means step down or lower acuity patient that we can call. And then usually this case, lower step down ICU, we can give like 1:2, means one staff 2 patients we can assign, like that they are doing. And then some regions may have different guidelines. Suppose usually it's like usually that shifting, usually 8 hours or 12 hours in the western countries, and all nowadays all they are going for the 12-hour shift, means each shift will be 12 hours. And then because of the care or the length of the care, it will be 12 hours, means there will be no intervention. That is the concept. Nowadays most of the hospital they will follow this one, uh, 1:12 means one staff for 12-hour shift will be there. And then some hospital we can see 1:4 means every 6 hours shift changing will be there. And then in some hospital 1:8 means one staff for 8 hours, like that this one will be there. Shift changing will be there. Here also you can see, here is the intubated patient, you can see here syringe pump, and then here ventilator you can see here. This is the staff, she is handling this patient, you can see here. Then physician, the doctors, the primary thing for the treating the patients, and usually physician, intensive staff consultants, usually recommended ratios are often between 1:8 means one consultant should be there for 8, and 1:15 means based on the acuity. Suppose patient is a very critical, step 1 and step 2. Step 1 very critical patient. In that condition, very critical patients means there should be one consultant for 8 patients. Suppose step down, lower acuity patients, in that cases one consultant for 15 patients, it's acceptable, like that. And then usually some guidelines they are telling there should be more than 14 patients. If you are keeping one consultant means it is good, like that. There is one thing is there. Usually some guidelines what they are saying, recommending no more than 1:14 for intensive coverage. Suppose some guidelines what they are saying, if it is not good if you are keeping one consultant for more than 14 patients, but that care means caring the patient, that in that caring it will be what we can say. Suppose if more 14 one consultant is seeing for 14 patients means it's not a good thing, no. And then it will be like crowd, and then workload, and then the treating the efficiency, it will be reduced. That is the thing. That's why that guidelines that will say usually less than 14 patient or 14 patient or 14 patient, less than 14 patient, it is usually recommended for one consultant. Usually residents, 8 patient, one resident should be there. Usually junior resident, senior resident, specialist, associate consultant, it will be there. Here you can see the hierarchy, and usually in the ICU, HOD means head of the department will be the senior most consultant, and then after that associate consultant he will become. After that specialist he will come. After that resident doctors will be coming. Here is the one. Then even this is the doctor scenario. Here nurses scenario. Usually charge nurse or ward in charge, they are the one prime. After that team leader they will tell, or shift in charge. In every shift there will be one in charge. They are the one lower than the in charge. They are taking care of the unit. After that senior register nurse will come. After that junior nurse will become junior register nurse. They are coming. This is the hierarchy of the ICU. We can see in the ICU setup. What is the size of the ICU? Usually in super specialty hospital, and the 10% of the total beds it should be reserved for the ICU setup. That is the thing. Usually general hospital, the acuity means the critical care acuity it will be less. So usually that, like that hospital, they are keeping only 2% of the bed. And then usually that ICU they will recommend one ICU setup, it should have only a 14 beds, because if more than 14 beds means the care treatment ratio it will be fall, like that. That is the thing. And then usually that optimal maximum size of the bed strength should be 14, and then minimum it should be 4 beds, like that. And then if number of beds required more than 14 means the bed capacity, if it is requiring more than 14 means usually it should have separate means 2 ICUs, like that. And then in some guidelines they will tell ICU it should have only 10 bed, like that, because the ratio of the patient increases means the care means the comprehensive care, the level it will be decreased. That is the concept here. Usually the size of the ICU, bed strength of the ICU, it should be recommended 14 or less than 14, it is highly recommended. See here also this picture you can see all the things. Here is the patient, you can see the monitor, cardiac monitor, you can see the ventilator. Here you can see the infusion pump. Here infusion pump is there, syringe pump is there. Here infusion is ongoing. This is the proper ICU setup. It is there. There is the adequate space for the assessment, and then physical examination for rounds, everything it will be there. Here is the proper bed is there. This is the thing you can see here. Then what is the type? Means based on this, there are variety of names, depends on the specific purpose and degree of dependency of the patient. Usually the ICU means which cases they are treating. In that basis they will give some names. See here you can see medical, usually MICU, medical intensive care. Means suppose this ICU, if ICU it's giving more prioritized for the medical cases like diabetes, ESRD, means end stage renal dysfunction, then stroke patients. If they are giving like that, means based on the clinical condition they are naming the ICUs here. Medical ICUs, MICU means medical ICU. Usually the medical related cases will be treated here. SICU, surgical intensive care unit, in that operated patients and all we are treating. TSU, trauma intensive care unit. Usually this ICU usually usually they will focus us to treat for the trauma patients and all. Transplant ICU they will say, usually liver transplantation, kidney transplantation ICU, the patient's lung transplantation. They need separate thing. Even there should be 0% infection rate, because the transplant patient itself, it is acting against the immunity and all. So there should be separate setup. Usually transplant ICU and all, the bed capacity it will be less, means less than 4 beds only it will be there. Transplant ICU and all. This one NICU, we can call it as neuro ICU or neonatal ICU. Neonates and all they will treat here. And the neuro ICU usually neurosurgery cases, means post-operative EVD insertion, craniotomy, like these cases they will handle here. Pediatric cases will be, means that age group less than 14, they will treat in pediatric ICU. Then cardiovascular ICUs, usually we use this one, cardiac, IBP patients and all they will treat here. This one CCU and cardiovascular, usually intensive, that one what we can say, thoracic, cardiothoracic specialists will be there. No, they will always look it for this one, cardiovascular ICU and all. They are the one treating doctors here. Coronary care unit, usually the like a medical care unit, that cardiac medical doctor, they will take care of this one. And then cardiac ICU, these all are the same. Then burn units, usually burn patients, and then patient need intubation, like that patient they will treat in the burn ICU. And then renal transplant unit or renal care unit, or one more kidney ICU, like that they will see, all will be here. Then ITU, this is the one thing, intensive treatment unit, another name for the ICU disease. Usually the highest level of patient dependency, means step I, means suppose some patients will be there, patient need very critically ill, like that patient, patient acuity will be high. Critically acute means this IT will be there, and then usually the one patient, 2 staffs will be there. This is the one. And then there will be most aggressive treatment and monitoring protocols will be there, like this case, like this ICU. CSU, cardiac surgery units, post cardiac surgery they will treat in ICU, sorry, in this ITUs and all. Means cardiac patients and all, they need what we can say, the aggressive treatment, and then so in that cases they will use it as they will call it as a ITU. Then specially care baby units, usually neonates and all, like that cases, invasive monitoring, they will use in the special care baby units and all. HDU, high dependency unit, usually this one they will call it as a step down ICU. After the suppose patient is intubated and the patient they cannot wean out from the ventilator, in that they will do, doctors will do tracheostomy, but tracheostomy is patient in lower ventilator settings, and like that cases they will send to like this ICU, HDU they will tell, high dependency unit, covering the area of an operating theatre with low level of monitoring, means because of already patient settled. So in that cases they will use the HDU, and then there will be high level of nursing care. This is the one of the thing. Means suppose there if low nursing care means, then we can call it this unit as a ward. So high level of nursing care will be there. So we can call it as a HDU, high dependency unit we can call. Then this is the important thing. What are all the indications for the ICU admission? Severe trauma. Suppose patient having big road traffic accident, and then there will be more bleeding things, and all patient need inotrope supports, everything means that case need ICU admission. Organ failure, this is one of the thing. Suppose patient has anything, what we can septic shock or ARDS, then patient have any cardiac failure. In that all like these cases, this one ICU admission is indicated. Post major surgery, suppose patient went craniotomy, or patient went EVD insertion, he is on ventilator support. After that procedure, if patient is in ventilator support or monitoring purpose, 24/7 monitoring setup, and ICU admission is indicated. Suppose patient is in respiratory distress, suppose patient is having the this one, patient may need a ventilator support, and that time ICU admission is indicated. These are all the main indication for the ICU admission. See here, a patient have heart and neurological emergencies, stroke cases, suppose cardiac arrest patients, these patients and all in ICU admission. And then severe infections, suppose patients having severe sepsis or severe pneumonia, in that case ICU admission is essential. Suppose if we are not treating severe pneumonia, if we are not treating means it will convert into ARDS. Again ARDS which will cause respiratory arrest, later patient will get cardiac arrest and he will die, that is the thing. Then sepsis also same, sepsis, septic shock, then again patient will go low cardiac perfusion, then patient will get cardiac arrest, so that is the thing. Then critical care, patient may need a critical care means patient is very sick, that patient medically unstable, and they need constant close monitoring and frequent adjustment to treatment. Like these cases need ICU admission. Here you can see the what and all are the equipment used in ICU. This is the one thing you can see here. This is the bed, you can see this is the crash cart, this is the cardiac monitor, this is the ventilator, you can see here, this is the ventilator, this is the defibrillator, this is the infusion pump, then this is the suction valve, yellow color is the suction valve, oxygen, this is the white color means oxygen valve, this blue means medical gas, you can see here, here is the stethoscope, here defibrillator, usually here defibrillator will be there in the crash cart. You can see spine board here, first row it will be medication, second row will be intubation thing, third row it will be the saline, cannula and all, here fourth row it will be containing this ICD insertion, central line insertion, all kit will be there. This is the crash cart, you can see here suction thing and all it will be there. Here is the bed, you can see here all the things. See here, this is the one thing I am seeing, this is the patient, see here central venous line, you can see here for infusing the IV, this one things and all. Here NG tube will be there, here you can see the NG, this is the central line, you can see the high JB and all, for infusing the medication or large quantity fluids and all infused through central liners. See here you can see the NG tube, with this feed you can infuse, you can administer. Then you can see the oxygen, here you can feed the oxygen therapy, maybe ventilator or face mask, nasal cannula, everything, CPAP mask, everything is there, and tracheostomy tube, everything will be there. Then oral endotracheal tube, ET tube, you can see here. Then here is the patient monitoring, ECG leads, it will be there here. Then patient BP monitoring and all, it will be there, and then whether manual BP or arterial BP, usually radial arterial line they will insert. Then here pulse oximetry for monitoring the saturation and all, you can see here. Here the DVT axis means the pneumatic cuffs will be there. Here you can see the urinary means that Foley's catheter and all, it will be there. Here you can see the closed suction catheter for removing, means taking out of the secretions and all. Then ET tube, everything you can see like this settings will be there, ICU and all. Here is the some of the instruments. See anesthesia machine, usually in the OR and all they are using. Here respirator, ventilator, you can see hospital bed will be there, and then usually the stretchers and all. ER emergency room, we can see here. Here also ventilator is there. Then here you can see the monitor, cardiac monitor. Here infusion pump, here electrocardiogram machine, here feeding pump. Here you can see the syringe pump, you can see here you can see the chest tube by CD, here pulse oximeter, then cervical brace will be there in order to Philadelphia neck collar and all they will be there. Here EVD monitoring and all it will be there. Then here here central venous catheter, here anesthesia breathing unit, here anesthesia mask, everything is there here. Oropharyngeal and nasopharyngeal area you can see here. Then you can see the endotracheal different size, and then bronchoscope, or then indwelling catheter, and then this is the one of the thing, ambu bag. This is the best thing to revive the patient for intubation, and then we are using. Here also you can see the bed monitor, then portable X-ray machine, then ventilator, then ECG machine, suction apparatus you can see here. Then laryngoscope with handles, different size of handle and blades, and you can see this. You can see bronchoscope, the doctor is intubating. This is the things. See here we can see some of the things what we are using. Ventilator, this is the one thing. It will be this one, it will call it as one of the magnificent one of the great invention by the Sir Ibsen. Because of this one, patient you can give good respiratory support and patient will be recovering. See, ventilator, artificial respirator, and protects airway, helps in lung recruitment. And this is the one, it will give the what lung is doing function. This ventilator is doing. Infusion pump, usually minimal amount of medication administration for inotropes, sedations useful. This infusion pump usually for giving the IV fluid larger administrations like IV fluid bolus, everything, it will be beneficial. Then defibrillator, even some dopamine and all, we can usually dopamine, dopamine we will use, we will administer with this infusion pump. Defibrillator usually used for main function of this one defibrillator to use shockable rhythms. This is the one thing for identifying the shockable rhythms we can use. And then defibrillation, even during code time, means that cardiac arrest time, we can use it as a monitor. Means we can check the electric, means that pulse of the patients, and that we can use. And then main this defibrillator use is detecting the shockable rhythms. Then patient monitors for monitoring vital signs. Then central CVP, central venous pressure monitoring we can do. Even ICP monitoring we can do, means intracranial pressure monitoring we can do. Then suction machines to remove the tracheal aspiration, it is useful. Then bed, to position the bed, it's where position the patient, it is very essential. Then tracheal tube for prolonging ventilation. Suppose patient they cannot wean out from the endotracheal tube or ventilator, it is useful because with the this rate of the with endotracheal tube, rate of the infection will be high, and then there will be high chances of the infections, and usually patient requires prolonged ventilation, means doctor will go for tracheal tube introduction, that is the thing. Then ultrasound machines to do to check the IVC, they are using. Quick scan, abdomen scan we can use during line insertion, central line invasive line insertion also it will be useful during cardiac arrest in order to confirm patient pulse, and this ultrasound machine is useful. Then crash cart, this one during cardiac arrest and it is must and should, means it has all the supplies, and to crash cart it will be useful. You can see here, I will show you again crash cart what and all it includes. You can see here. See, this is the crash cart. Usually in the first ear defibrillator will be there. In the first row, you can see this one, first chamber, we can see the medications and all, emergency medication, levofed, adrenaline, dopamine, then calcium gluconate, sodium bicarbonate, everything, deep 50% dextrose, everything it will be there. In second row, intubation things will be there. This this one, ET tubes, then what we can say, laryngoscope and everything will be there. In third, we can see the IV fluid, then cannula, then IV set, 50cc syringe, all syringes it will be there. In fourth, for central line insertion, dressing set, then ICD insertion, everything will be there. And then usually here stethoscope will be there. Inside there will be ambo bag, it will be there here. This is the crash cart. This is also one of the important thing in the ICU setup. Then dialysis machine, this is the one. In order to treat AK, acute kidney injury, or ESRD patient, this is useful to remove That dialysis, this is the process. It will correct the acidosis, metabolic acidosis, and then it will removes urea and potassium from the patient body. Then syringe pump. This is the one thing. Usually syringe pump and minimal amount, and then usually inotropes, leofid, epinephrine medication. It is most useful syringe pumps. Then you can tell anesthesia machine. Usually in the OR and all they are using, instead of ventilator they are using pulse oximeter for monitoring oxygen saturation and all. ECG machine, in order to usually 12 leads ECG they will use to analyze the electric conductivity of the heart we can use. And then arterial line cables, usually in order to monitor arterial blood pressure and all, it is useful. And then BiPAP RNA. This is like especially COPD patients and line fibrosis patients. They need continuous oxygen support with positive pressure. Like that cases, BiPAP or NIV it is useful. Then central line cables, in order to monitor central venous pressure, we can use this one. Usually hypovolemia and it means in order to fluid resuscitation, this is useful. Then sterile trolleys for dressing and all, it is useful. Medication lockers means patient medication sheet should be there, no? In order to keep this medication lockers is useful. Then O2 cylinder for oxygen and all, oxygen supply and all, O2 cylinder is essential. Gyroscope, usually the advanced airway insertion, like that they will tell, means with the visualization of the airway they will be using this gyroscope. Patient they will intubate. This is the one. Laryngoscope, this is since long era for using for intubation and all. Warmer for hypothermia prevention, it is useful. Blood warmer means some patients they will have low because of the low perfusion and all, no, usually hypothermic. In that cases, if you are using warmer means that is the good. Then the blood warmer, even for blood toxic, severe hypothermic patient, if you are giving again cold means there is high chances of bradycardia, like that things and all. That's why blood warm also it's indicated. Then sterile dressing set for during dressing and all, it is useful. Suture set, any line insertion in nasal line insertion, suture removal or ICD insertion time, it is useful. Then portable ventilator, suppose patient if you are shifting for any CT MRI, that time it is useful. Spotlight, usually the percutaneous tracheostomy they are doing in the ICU means in the ICU and all, it is useful. Then echo machine, this is the useful to create ultrasound to create images of the heart. In order to get the patient to have any cardiac arrest symptoms and all, it is useful echo machine. They can see the EF and all. This is the one. See here, this is the gyroscope. You can see here with advanced airway. We can see the patient. This one you can see here airway and all. You can see the epiglottis, everything here. Then another thing is glucometer. You can see here glucometer in order to refer to glucose level. Glucometer is essential. ABG machine to do the ABG, arterial blood gas, means in order to know the acidosis or acidosis, alkalosis of the or the oxygenation, means SpO2. This is useful. PO2 and all is useful. Bronchoscope, usually in order to detect anything of abnormality in the bronchi, bleeding, anything we can see here. Central monitor to observe all patient data and all. Computer for documentations and all, and to check lab report also it is useful. Medication room for preparing medications and all, it is highly essential. Then high alert medications cupboard. This is the one thing. This high alert medications thing is, it is a safety medication. Suppose if little altering the dosage or if you are giving wrongly, means the consequence will be very very sick, means patient will get this one means if wrong dose or something medication error, it will cause the more effect on the patient health. So usually for storing the this high alert medication, there should be proper secured high alert medication cupboard should be there. And then when narcotic medications also, to store the narcotic medications, it is essential narcotic cupboard. Then storeroom for logistics supply, this is it is useful. Then see here, you can see the bronchoscope. Doctor is visualizing the lung parenchyma and all, you can see here. Then here stethoscope, you can see here. Stethoscope usually auscultating the lung sound, bowel sound, in order to confirm the ET tube, everything it will be useful. Then feeding pump to give continuous central feeding. The same feeding pump is useful. Then oxygen humidifier, oxygen supply. Means humidified oxygen supply, it is used for. Then gastric intubation, what we can say, NG tube, OG tube, means oral gastro tube or nasal gastro tube, it is also one of the thing. Refrigerator, low temperature medication like vasopressin, you cannot store in the outside, means the temperature falls below than the 8 degree temperature. Storage means usually we will keep it in the refrigerator. So this one also required in ICU. Thermometer to check temperature. Nebulization, for nebulizer, for giving nebulization like mucolytics, bronchodilators, the mucomix they will tell. Then bronchodilator like budesonide, salbutamol you can use here. Portable BP apparatus, suppose in emergency condition we can use. Massimo for check the saturation, then seizures monitoring, that this one also we can do with the Massimo machine. This is the important equipment of the ICU what we are using in the ICU setup.